Child CPR. Cardiopulmonary resuscitation or CPR is a life-saving technique that involves both chest compressions and rescue breathing. When the heart stops, the lack of oxygenated blood can cause brain damage in only a few minutes. Immediate CPR can double or triple chances of survival after cardiac arrest or heart attack. Determine if the child needs CPR before you start it. Use CPR when the child is not breathing normally. Depending on the size of the child, you can use 1 or 2 hands to give compressions. Because children have smaller chests than adults, the depth of compression should be only 1.5 inches. The compression and breath rate should be the same for children as for adults, that is 30 compressions to 2 breaths. A child might need CPR if he stops breathing in any of the following circumstances: cardiac arrest, choking, electrocution, accident or trauma, drowning, suffocation, poisoning, drug or alcohol intoxication. CPR steps. Ensure the area is safe and check for any hazards. Assess the child's responsiveness. Check whether the child is awake or responds to verbal commands. Gently tap the child on his shoulder and ask loudly, "Are you okay?" or "Wake up." If the child answers, CPR is not needed. If the child is unresponsive and not breathing normally, make sure someone is calling an ambulance. Position the child on his or her back and start chest compressions immediately. Combine chest compressions with rescue breaths, providing 2 breaths after every 30 compressions. If your child responds by answering or moving, reassess the situation and check whether the child is in danger and get help if needed. Chest compressions. Start CPR by laying the child on a firm, flat surface. Place the heel of one hand over the lower third of child's breastbone and give him 30 quick chest compressions. Be sure to push hard enough so child's chest moves approximately 5 cm down, which is approximately 1/3 of the chest diameter. When performing chest compressions, proper hand placement and quality of chest compressions is very important. Wait for the chest to come all the way back to its initial position between compressions. Give 30 compressions at a rate of 100 to 120 compressions per minute. This will get the blood flowing to the child's brain and other vital organs. Check and clear the airway. If the child is not breathing or is breathing irregularly, carefully open the child's mouth and remove if any visible obstruction in the mouth. This could include his tongue, food, vomit, or blood. If you find a blockage, place the child in recovery position. Clear blockages with your fingers, then check for breathing. Now check for breathing. Look for chest movement, listen for breath sounds, and feel for child's breath on your cheek or ear. If the child is not breathing, start mouth-to-mouth breathing. Look, listen, and feel for no more than 10 seconds before deciding that the child is not breathing. Start rescue breaths. Open the child's airway using the head tilt chin lift maneuver. Place your palm on child's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward to open the airway. Close the child's nose and cover the child's mouth with yours, making a seal. Push on the chest 30 times, then give 2 rescue breaths. Each breath should be just enough to make the child's chest rise and should be no more than 1 second in length. Make sure you see the child's chest rise with each breath. Continue resuscitation until the child shows signs of regaining consciousness, that's normal breathing, coughing, movement of body, or until help arrives. Once the child starts breathing, put him in the recovery position and pay attention to his breathing until help arrives. CPR is a life-saving first aid procedure. The steps of CPR vary depending on whether the person is an infant, child, or adult. However, the basic cycle of chest compressions and rescue breaths remain the same. Thank you.